It is Health Diary. Thank you for joining us. My name is Gladys Gachanja, and today we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, most often than not, when you hear somebody is suffering from anemia, first thing you think is that person should be taking more spinach, should be taking more liver. And yes, those solutions can actually help out with one or two of their anemias, but the truth is there are several types of anemias, and each with a different cause. So we find out more about anemia today right after this fact of the matter. Anemia is a condition in which the body lacks enough healthy red blood cells to carry adequate oxygen to your body's tissues. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term and can range from mild to severe. Treatments for anemia range from taking supplements to undergoing medical procedures. Some types of anemia are preventable by eating a healthy and varied diet.
Nilikuwa na mtoto mgonjwa anaitwa Mary, alikuwa na shida ya upungufu ya damu na nilimpeleka hospitali ya Kajiado na ndio akapata kuongezewa damu. Nilielezewa niendelee kumpea machakula ili aongeze damu. Alipoanza kugonjeka alikuwa ameanza kuzimia, akafura mwili na mikono zilikuwa nyeupe sana. Tuko na shida ya chakula. Mimi kama mama ndio naenda kibarua. Saa zingine ndio watoto wapate kula. Sasa ni changamoto kupata hii chakula kama mboga, maini. Tunapata tu chakula ile tu ya kibarua, ile kama unga paketi moja, saa zingine hatuna. So imekuwa ngumu. Hata shule huwa haendi maana ya hii shida ya ugonjwa, na pia school fees hakuna. Niko na watoto wengine na pia ni changamoto kupata hata pesa ya kupeleka shule. Sasa nimeamua tu kushughulika na huyu ambaye amegonjeka. In this community of Maa, anemia is very common. Since we don't consume a lot of vegetables, we keep a lot of animals, and most of the time we only depend on milk. So what we do as a hospital, we have our mothers coming for the antenatal clinic early, and what we do, we screen them for anemia. Immediately all mothers are started on folic ferrous for the antenatal clinic, and we are also encouraging families to have a family garden where they have a family garden with some vegetables for their daily consumption. We have our community health workers who visit every family to assess the health system of the family. So sometimes there are challenges accessing to the interior part of our clients. But as a county, we think now we are diverse with our health system. We have health centers, we have dispensaries, I think spread all over the county, so that at least these mothers are able to access the antenatal care early.
So the conversation is on anemia. To help us understand this better, we have Dr. Kibet Shikuku, who is a hematologist, and of course Amina Paul Omondi, who is living with aplastic anemia. Gentlemen, thank you for joining me on this conversation. Now, Dr. let's start off with understanding this, a lack of healthy red blood cells in the body. So what is the role of red blood cells in the first place before we understand the deficiency of the same?
From our biology, we understand that there are 3 types of cells, broadly speaking. We have the red cell, the white blood cell, and the platelet. Each of those play different roles. The red cells are meant to assist in moving oxygen from the lungs to the tissues, basically to the cells. It also removes wastes, in the process by mobilizing, various wastes from the body, either back to the lungs for exhalation. So the red cell is important in ensuring that the body functions, normally and appropriately. And any abnormality associated with the red cell then essentially affects the body and its function.
Okay, so how can the body acquire deficiency of the same?
You could look at it from 3 different perspectives. The first is you look at the factory where this red cell is produced. So naturally, our cells are produced in the bone marrow in an adult. For a baby, if you are carrying, some fetus, the red cell production occurs in the organs. And this takes place, in different organs within the body. But then when you are born, your bone marrow takes over that responsibility. And so if you have a challenge within the marrow, which is the factory, then you are likely to get a reduction in the number of cells. The second thing is once the red cell has been produced, it doesn't reside and stay in the marrow. It has to get out so that then it functions. And for it to get out, it has to be moved through the blood vessels, get into the cells as it relays or delivers whatever components the cells might require, then get back into circulation for it to move. So if you have any challenge as the red cell moves, then you could lose it. You could get cut, for example, or you're operated on, or you have challenges in certain parts of the body that allows, loss of the red cell. All those are possibilities of you reducing the number of red cells in the process of the red cell moving around. The third way of looking at the red cell problems is when you have challenges affecting the cell itself. You could actually be born with the problems of the red cell, okay? And those problems could be intrinsic to the red cell. But you could also have problems around the red cell. The environment is not conducive for the red cell, okay? So you can have challenges within the red cell that can affect the functionality of the red cell. But if you look at the red cell itself now, the red cell has 3 major components, okay? It has the outer membrane. So you could have challenges with that membrane, okay? We call them membrane-related disorders. Inside the red cell is hemoglobin, and that is the most important component that assists you in moving oxygen from whichever area to the tissues. So if there are problems with the hemoglobin inside the red cell, we call those hemoglobinopathies. And I think you hear people talking about sickle cell, which is a hemoglobin deficiency. The third component within the red cell is the enzyme. So the enzymes are necessary to sustain the red cell. If you have challenges again with the enzymes, you can potentially destroy the red cell. Then you can have parasites. Malaria, for example, can get into the red cell. In the process of multiplying in the red cell, it makes the cell burst.
Amina, you were diagnosed with aplastic anemia. When was this done?
November 2019.
And what led to the diagnosis? What were you dealing with?
I had experienced anemia. I was anemic, that is. We thought it was just a normal being anemic, having the deficiency when it comes to iron. But later on, when the condition worsened up, each and every doctor that I could meet was just like advising me to go further to the bone marrow and check if I could be having any problem with my bone marrows.
The symptoms were what exactly?
I could not engage myself in a lot of activities, and sometimes even moving around, it was quite a problem. Experiencing the chest pain and maybe the fatigue. Yeah, so then if you could just see, I was a bit quite pale, a bit pepper white. You can just see my hands and see even my tongue. Someone could tell like I have a problem. I had a problem by that time. Yeah.
Okay, so Daktari, again, many forms of anemia, each with their own causes. Let's start with aplastic. What are the general causes?
Aplastic anemia is basically inability of the bone marrow to function normally. And so aplasia could arise from 3 different reasons. One is you're born with inability to produce anything. Your marrow naturally is not capable. And we have conditions that actually have been associated with that. And you're born with that condition. The second category is when you have external aspects getting into the marrow. You have insults in the marrow, and the insults could range from drugs that we take, infections, okay, chemicals, viruses, you know, HIV, CMV. So there are different viruses that have been associated with affecting the bone marrow. And then finally, you can get your body producing antibodies that target your cells. And so it is possible that Paul may have been exposed to any of those, and by extension may have affected production of his cells. And when that happens, then we have to try and intervene and see whether we can actually reverse some of the losses associated with production.
So are we saying the doctor said you were not born with it?
Yeah, I was not born with it.
When they did the diagnosis, what did they say would be the ideal form of treatment?
So with the severeness, I was just advised to have a stem cell transplant.
When we think about risk factors, at times they say genetics can be at play here. Do you have anyone in your family with any form of anemia, if not aplastic?
Not really, because even it was quite a challenge for my family, relatives, and getting to understand the issue being that no one has ever been with such a condition, and it took us a lot of time just to get to know what the problem was. Yeah.
Dr. Is there ever a familial connection to any of their anemias?
Yes, and that's why I said it could actually be congenital. You are born with it because you know, you have some gene that is abnormal, and a lot of times we talk of conditions that are bone related. You have congenital problems that, you know, have been associated with aplastic anemia. One that is commonly seen in our facility is Fanconi anemia, and that is an anemia where you know, a patient is born with various deformities, including the bone. Actually, when you look at them, you can classically diagnose them. But having said that, you did ask about severity. So we classify anemia based on the amount of hemoglobin in circulation. So our natural tendency is to have a certain number of red cells in circulation to give you a specific amount of hemoglobin. Our normal values range from 11 going onwards for women, between 11 and 17. Then for men, it's from 12 to 18. So anything below that then is classified as anemia. If you have a range between 9 and 10, we call that mild. Then if you have a range between 8 and 9, that is moderate. Anything below 7 is said to be severe. Then if you want to confirm that someone has aplastic anemia, which Paul has, you want the marrow to have been destroyed above 70%. If your marrow cannot produce above 70%, then we classify that as aplastic anemia.
Okay, now we're about to take a short break. When we come back, Dr. I'd like us to talk about how pregnancy can actually be something that can instigate anemia when we come back. Welcome back to Health Diary. My name is Gladys Gachanja. We still have Dr. Shikuku, who is a hematologist, and of course, Amina, who is living with aplastic anemia. And Dr. before we took the break, I came across the fact that your immune system might attack your bone marrow during pregnancy. How come?
Pregnancy on its own is a predisposition to anemia. By the fact that, you know, when you're carrying a baby, that's another human being. And the needs for iron, the needs for blood generally increases. You need certain components for you to produce blood. And one of them is iron. The other vitamins that are essential in red cell production, like vitamin B12, folate, and the likes. And the other misfortune is that women generally tend to be disadvantaged because of their monthly periods. So the certain nutrients tend to be at the lower age. Sometimes we try to check for the mother's rhesus factor because you can develop antibodies against your red cells that can destroy the red cell.
So, Amina, when you got the right diagnosis, what did you have to change in terms of your lifestyle to ensure that you were able to manage this condition?
I don't interact much. I don't engage myself in a crowd. Most probably I do a lot of things indoors. I don't move around. Just the other day I was even, I had contracted COVID. So yeah, that was in January.
How was the experience?
It was really bad, if I can tell. Yeah, at that time actually I had low counts too at the same time, so it was really a worse experience. Another thing is the diet. I had adjusted much into my diet. Yeah, being that you have to do a lot of food stuff that can help you, can help in boosting the, at least boosting the blood.
So are we talking about the spinaches?
The spinaches, yeah. So I do a lot of food stuff that helps. I don't take like tea. I don't take, I do soft drinks. So I've just adjusted. The life has changed now into other, yeah, so I'm so cautious about my diets much.
And is this a normal occurrence for all patients with anemia or just a plastic?
Depending on the type of anemia, we try to intervene appropriately. If the anemia is due to the nutritional component, then we try to give you, components that would assist in beefing up the production. If iron is the problem, we give you iron supplements. If the vitamins are the problem, we give you the vitamins. If the problem is the marrow itself, because something is attacking it, and actually I didn't talk about very many other things that can infiltrate the marrow. For example, if you have cancer, cancer can infiltrate the marrow and by extension cause anemia. So if you have infiltrative, insultive aspects, then we try also to intervene. Including if it is antibodies, we actually try to tame the antibodies by bringing in things that can, reduce antibody production. So we use immunosuppressant drugs. If the cause is because the red cell was designed with ability to get destroyed, I talked about hemoglobin deficiencies, for example. For such kind of anemias, your problem is not iron, for example, because then you are destroying your cells and keeping a lot of iron. Iron is your problem because you have too much iron to deal with. So we have to even remove that iron rather than give you more iron. Paul has to keep going to the hospital time and again to be given blood from someone else. And that's why blood transfusion is important. Blood donations are important. So we ask people to donate so that then Paul can survive. The other thing is we have to make sure he's protected from unnecessary exposures to infections. His platelets are low. He can easily bleed. That simply means he cannot engage on physical activities and things of that nature.
Okay. So
we would advise appropriately.
All right. So he talks about blood transfusion. How often does this happen?
When I wasn't under the immunosuppressant medicine, it was taking roughly 3 weeks. Then I had to get back for a transfusion. But having taking the meds, actually I always take a month, roughly a month, or if it extends a bit, just take like 2. Then I have to go for the blood transfusion. Yeah.
A transplant, that of the bone marrow, is something that is also suggested. Have you explored this option?
Having the procedure done, it's quite expensive because it costs 5 million. And an individual has to travel to India for the procedure to be done.
Because it's not done in Kenya.
Yeah, then the financial thing, it was quite a challenge. Actually, I can remember when I was told, then I had organized for a fundraising but it never worked, being the pandemic just came in, then everything had to fall back, and yeah, there we are.
Blood transfusion, medication, the immunosuppressants, they all cost something. How much and how do you manage?
Getting donors, sometimes you inquire for donors and these people don't show up. The other thing is the meds, they are really expensive, and for the NHIF it caters for a month only. Actually, when you go to the billing, they only tell you like this one is too expensive, so we can't provide you with exceeding a month. So it's either you just take for a month, then if maybe you'll have cash, you'll get to purchase some outside having the prescription. But if you don't have, you run out of cash, you just wait for the transfusion, go back to the hospital and get the transfusion again done, and then you start from square one. Yeah. Insurance
companies?
I had not invested in a cover. So when I came to learn about this, I had consulted different people, even the doctors, but being that I had already have this the condition, I was just being told that it will be a bit challenge.
Daktari, I mean, there's so many Kenyans who live with different types of anemia. I mean, if this is how or what they have to go through, how many can even manage treatment?
I mean, truly speaking, this is now where I keep saying we can't continue with a lazy government. If you had Paul well, he's just shy of saying he spends quite a bit. I mean, I don't think he spends less than about 20,000 every month just for medications alone. Paul is not supposed to be mobilizing donors. The government should actually be giving Paul blood, not him asking relatives to come and donate. Those are not even the best of donors. And I'll tell you, by the time Paul gets to the hospital with an HB of 3, he's almost falling down. And you can't hold him waiting for blood. For us to discharge him, our target is at 10. Now, 1 unit gives you 1 gram. So Paul will require 7 donors for him to be able to go back home. And so if you came in and said, oh, you know, I have a plastic anemia, and the insurance companies advise that this is a chronic condition, they'll not cover. And so they'll, you know, keep dodging around because they know Paul has to keep frequenting the hospital time and again. The other thing is in the process of getting care, like now Paul has to survive on blood donations. Safety is important. He could easily get blood transmissible infections, hepatitis, HIV, you know, and many other conditions that are transmitted through blood. And this is why the government has to take up the donation program so that then blood that is administered is safe. Otherwise, he would get exposed. Other than now he's a plastic anemia, and then he gets exposed to other conditions that are completely irrelevant.
What would be your clarion call for those who are, or the powers that be?
For such conditions, because I've seen a lot of young men suffer much, and sometimes, you know, you even get worried when you're suffering from the same health condition and with a fellow patient, and sometimes they leave us, then you feel like it's an end. Yeah, so it's just being that we always are positive and positive with life. Government should invest much on such conditions. These are life-threatening disorder. What I just want to tell those stakeholders or those people responsible, they should just invest much, yeah, for these such conditions. Yeah.
Okay, and Dr. I mean, as we said, different types of anemia, and Kenya actually has a burden of the nutrition-induced anemia. Talk more about this and how we can ensure that we actually eradicate this kind of anemia.
Our nutrition has to be taken care of. Remember, it is nutritional. So if we are in this pandemic and people are unable to balance their dieting well, then, you know, you get exposed to deficiency, and you may not even realize. The deficiency-related anemia due to, you know, the various components that might be required is pretty common in this country. to the extent that we really need to educate our people on what to do, what kind of foods they need to take, how that food should be cooked. Remember, vegetables, for example, would give you certain components. But how do we manage our vegetables? A lot of times we overcook our vegetables, and so we destroy everything else that we need out of that vegetable. So there's a lot in terms of education. And again, just to digress a little bit on what you had asked Paul on where we should be, I want to categorically state that as a country, I think we are lagging behind in supporting patients with anemias. While we know that stem cell transplantation, for example, for him would be applicable, I don't see why Kenyans should be traveling out of Kenya to seek bone marrow transplants. Tanzania already has a bone marrow transplant. Why not us? Tanzania is able to do stem cell transplantations. Why not Kenya? So where is the problem? What is the disconnect? And I think that should be a bigger conversation that we need to address as a country.
Very well said. Dr. Kibet Chikuku, who is a hematologist, and Amina Paul Omondi, who lives with aplastic anemia. Thank you for being part of this conversation. And definitely we've learned a thing or two about the various anemias we have out there. Well, time now for the health tip.
This exercise is excellent for pregnant mothers because it does not involve a lot of movement. You can be able to do it without any risk of injury. All you have to do is stand with your feet close together, then step sideways as you raise your arms. Go to half squat position. You don't have to squat low. Then go back to starting position as you lower your arms. The other side, just like that. The lower you go, the more you engage your muscles. This exercise is working so many muscle groups. It's working your shoulders, your quadriceps, your hamstrings, and your glutes. So do it as many times as you can.
Great information shared today on anemia and, of course, the different types that we have. Remember, consult a doctor if you have any of the symptoms that have been talked about. This has been Health Diary, coming to you from the 4 Points by Sheraton here in Halinga. My name is Gladys Gachanja. Until next time, see you. Thank you. And you helped us understand a different form of anemia. Yeah, but don't you worry, my head in medit. Yeah, so we're good. I will reach out to our people at Kajiado.
There was just the last admission I was in the ward.
With a suppressed immune system.